Schizophrenia. Schizophrenia is a medical disorder characterized by continuous or relapsing episodes of psychosis. Major symptoms include hallucinations, typically hearing voices, delusions, and disorganized thinking. Other symptoms include social withdrawal, decreased emotional expression, and apathy. Symptoms typically develop gradually, begin during young adulthood, and in many cases never become resolved. There is no objective diagnostic test. Diagnosis is based on observed behavior, a psychiatric history that includes the person's reported experiences and reports of others familiar with the person. I'm just eating a big salad. It's I think it's something Dijon. As you can see here, it's like kale slaw with Dijon something dressing. I forget the brand. It was one of those pre-made salad mixes that you just add to. It comes with dressing, and you can just add the dressing in. Diagnosed with schizophrenia, symptoms and functional impairment need to be present for 6 months. That's from the DSM-5 or 1 month ICD-11. I think the DSM-5 is like a manual on psychological or personality disorders and stuff. Many people with schizophrenia have other mental disorders, especially substance use disorders, depressive disorders, anxiety disorders, and obsessive compulsive disorder. About 3% to 7% of people are diagnosed with schizophrenia during their lifetime. In 2017, there were an estimated 1.1 million new cases, and in 2002, a total of 24 million cases globally. Wow, that's actually a lot more than I thought. Males are more often affected and on average have an earlier onset. The causes of schizophrenia may include genetic and environmental factors. Genetic factors include a variety of common and rare genetic variants. Possible environmental factors include being raised in a city, childhood adversity, cannabis use during adolescence, infections, the ages of a person's mother or father, and poor nutrition during pregnancy. About half of those diagnosed with schizophrenia will have a significant improvement over the long term with no future further relapses. and a small portion of these will recover completely. The other half will have lifelong impairment. In severe cases, people may be admitted to hospitals. Social problems such as long-term unemployment, poverty, homelessness, exploitation, and victimization are commonly correlated with schizophrenia. Compared to the general population, people with schizophrenia have a higher suicide rate, about 5% overall, and more physical health problems, leading to an average decrease in life expectancy by 20 to 28 years. In 2015, an estimated 17,000 deaths were linked to schizophrenia. The mainstay of treatment is antipsychotic medication, along with counseling, job training, and social rehabilitation. Up to a third of people do not respond to initial antipsychotics, in which case clozapine may be used. In a network of comparative meta-analysis of 15 antipsychotic drugs, clozapine was significantly more effective than all other drugs, although clozapine's heavily multimodal action may cause more side effects. In situations where doctors judge that there is a risk of harm to self or others, they may impose short and voluntary hospitalization. Long-term hospitalization is used on a small number of people with severe schizophrenia. In some countries where supportive services are limited or unavailable, long-term hospital stays are more common. Signs and symptoms. Schizophrenia is a mental disorder characterized by significant alterations in perception, thoughts, mood, and behavior. Symptoms are described in terms of positive, negative, and cognitive symptoms. The positive symptoms of schizophrenia are the same for any psychosis and are sometimes referred to as psychotic symptoms. They may be present in any of the different psychoses and are often transient, making early diagnosis of schizophrenia problematic. Psychosis, noted for the first time in a person who is later diagnosed with schizophrenia, is referred to as the first episode psychosis. Positive symptoms are those symptoms that are not normally experienced episodic episode of schizophrenia include delusions, hallucinations, and disorganized thoughts and speech, typically regarded as manifestations of psychosis. Hallucinations occur at some point in the lifetimes of 80% of those with schizophrenia, and most commonly involve the sense of hearing, most often hearing voices, but sometimes can involve any of the other senses of taste, sight, smell, and touch. The frequency of hallucinations involving multiple senses is double the rate of those involving only one sense. They are also typically related to the content of the delusional theme. Delusions are bizarre or persecutory in nature. Distortions of self-experience, such as feeling of one's thoughts or feelings are not really one's own, to believing that thoughts are being inserted into one's mind, sometimes termed passivity. The phenomena are common. Thought disorders can include thought blocking and disorganized speech. Positive symptoms generally respond well to medication and become reduced over the course of the illness, perhaps related to the age-related decline in dopamine activity. Negative symptoms. Negative symptoms are deficits of normal emotional responses or of other thought processes. The 5 recognized domains of negative symptoms are blunted affect, showing flat expressions or little emotion, algia, poverty of speech, anhedonia, an inability to feel pleasure, asociality, that is lack of desire to form relationships, and avolition, a lack of motivation and apathy. Avolition and anhedonia are seen as motivational deficits resulting from impaired word processing. Reward is the main driver of motivation, and this is mostly mediated, not medicated, by dopamine. It has been suggested that negative symptoms are multidimensional, and they have been categorized into 2 subdomains of apathy, or a lack of motivation, and diminished expression. Apathy and includes avolition, anhedonia, and social withdrawal. Diminished expression includes blend affect and algia. Sometimes diminished expression is treated as both verbal and non-verbal. Apathy accounts accounts for around 50% of the most often found negative symptoms and affects functional outcome and subsequent quality of life. Apathy is related to disrupted cognitive processing affecting memory and planning, including goal-directed behavior. The two subdomains have suggested a need for separate treatment approaches. A lack of distress relating to a reduced experience of depression and anxiety is another noted negative symptom. A distinction is often made between those negative symptoms that are inherent to schizophrenia, termed primary, and those that result from positive symptoms from the side effects of antipsychotics, substance use disorder, and social deprivation, deemed secondary negative symptoms. Negative symptoms are less responsive to medication and the most difficult to treat. However, if properly assessed, secondary negative symptoms are amenable to treatment. Scales for specifically assessing the presence of negative symptoms and for measuring their severity, and their changes have been introduced since the earlier scales, such as BANS, that deals with all types of symptoms. These scales are the Clinical Assessment Interview for Negative Symptoms, CAINS, and the Brief Negative Symptom Scale, BNSS, known as the second generation scales. In 2020, 10 years after its introduction, a cross-cultural study of the use of BNSS found valid and reliable psychometric evidence for the 5-domain structure cross-culturally. BNSS is designed to assess both the presence and severity and change of negative symptoms of the 5 recognized domains and the additional item of reduced normal stress. BNSS can register changes in negative symptoms concerning psychosocial and pharmacological intervention trials. BNSS has also been used to study a proposed non-tissue treatment called SCP-363856. Findings supported the favoring of 5 domains over 2-dimensional proposition. Cognitive symptoms. An estimated 70% of those with schizophrenia have cognitive deficits, and these are most pronounced in early onset and late onset illness. These are often evident long before the onset of illness in the prodromal stage and may be present in early adolescence or childhood. They are a core feature, but not considered to be core symptoms, as are positive and negative symptoms. However, their presence and degree of dysfunction is taken as a better indicator of functionality than the presentation of core symptoms. Cognitive deficits become worse at first episode psychosis, but then return to baseline and remain fairly stable over the course of the illness. The deficits in cognition are seen to drive the negative psychosocial outcomes in schizophrenia and are claimed to equate to a possible reduction in IQ from the norm of 100 to 70 to 85. Cognitive deficits may be non-social or social cognition. Cognition is the ability to receive and remember information and includes verbal fluency, memory, reasoning, problem solving, speed of processing, and auditory and visual perception. Verbal memory and attention are seen to be the most affected. Verbal memory impairment is associated with a decreased level of semantic processing relating meaning to words. Another memory impairment is that of episodic memory. An impairment in visual perception that is consistently found in schizophrenia is that of visual backward masking. Visual processing impairments include an inability to perceive complex visual illusions. Social cognition is concerned with the mental operations needed to interpret and to understand the self and others in the social world. By the way, if you're wondering what I'm reading from, it's a Wikipedia article, wikipedia.org. is also associated impairment on facial emotion perception. It's often found to be difficult. Facial perception is critical for ordinary social interaction. Cognitive impairments do not usually respond to antipsychotics, and there are a number of interventions that are used to try to improve them. Excuse me, let me get a sip of water. Cognitive impairments do not usually respond to antipsychotics, and there are a number of interventions that are used to try to improve them. Cognitive remediation therapy is of particular help. Neurological soft signs of clumsiness and loss of fine motor movement are often found in schizophrenia, which may resolve with effective treatment of FEP. Onset typically occurs between the late teens and early 30s, with a peak incidence occurring in males in the early to mid-20s and in females in the late 20s. Onset before the age of 17 is known as early onset, and before the age of 13 can sometimes occur, is known as childhood schizophrenia or very early onset. Onset can occur between the ages of 40 and 60, known as late onset schizophrenia. Onset over the age of 60, which may be difficult to differentiate as schizophrenia, is known as very late onset schizophrenia, like psychosis. Late onset has shown that a higher rate of females are affected, as they have less severe symptoms and need lower doses of antipsychotics. The tendency for earlier onset in males is later seen to be balanced by a post-menopausal increase in the development in females. I think I'll just stop here, as it's been about 30 minutes. Well, thanks for watching. Okay, bye.